We're most honored to have among us Professor Robert Rakel from the United States, who will deliver the keynote address. Professor Rakel has published extensively and is the editor of several books, notably the textbook of family medicine, Kant's Current Therapy, and Saunders' Manual of Medical Practice. It gives me much pleasure to present to you Professor Rakel.
At the time, it wasn't easy to become a family physician. It wasn't easy to enter the institution of medical specialties in the United States at that time. For decades, general practice primary care had languished and had frankly been looked down upon. We needed someone who had great stature, but the stature had to be someone who carried himself with professionalism and confidence. It was so critical in those days for this program to get off the ground, for family medicine, which was struggling in those days, to gain the respect that it needed. We needed some people who could be respected. That was clearly Bob Rakel.
I was tall when I was young, so I tried to play basketball. The most fortunate thing in my life is I was lousy, so I had to study instead. And I had a chemistry lab in my basement, did a lot of chemistry and enjoyed it in school, enjoyed biology better, and was first in my high school class in biology. And that's what attracted me toward medicine, because I enjoyed the sciences, I enjoyed people, and that way I really could interact with people and get to know them well. I've been a practicing family physician in Newport Beach for 10 years, so I enjoyed it thoroughly, and I wanted to be at the forefront of this new specialty in 1969. So my department at Hoag Memorial Hospital in Newport Beach, where I'd been practicing, was one of the first 12 in the country residency programs to get started.
Back in the 1960s, there were many faculty here who recognized that the University of Iowa needed to be part of a national effort to professionalize general practice into family medicine. They looked far and wide, and they found this person who was not only well practiced, but well read, and he had already written, which was very unusual for someone who was in primary care back in those days. And they found Dr. Bob Rakel in California.
Bob Ray, who I consider the best governor Iowa has ever had, was governor when they were recruiting me. And I was impressed that they sort of pulled out the stops. They had the governor call me in Newport Beach to talk me into considering the position here at Iowa. And I told him, I said, well, my family, we're all skiers, and you don't have any mountains in Iowa to ski down. He said, we'll dig a hole. I thought that was the best political answer I've ever heard.
I know that Dr. Rakel had a number of administrative challenges when he started the Department of Family Medicine here at the University of Iowa. It was a specialty that needed to be established, but in academic medicine, it was a tough go. Dr. Rakel had the strength and tenacity and vision to push the department and his faculty to do research in primary care, and he was a prolific author, writer and scholar himself. He published so many of the Sentinel textbooks in family medicine. He really was the voice and face of the emerging specialty of family medicine.
Bob was one of the vanguard of people who, with a lot of other national leaders back in the day, basically invented the specialty family medicine, the training for family medicine, and then he operationalized it right here in Iowa City at the University of Iowa when he developed the program.
There probably would not have been a specialty of family medicine without Dr. Rakel's early contributions, both as one of the important forces that led to the establishment of the specialty in 1969, but more importantly as a leader not only in organized medicine, but in establishing and creating family medicine departments.
Don't go easy on him, Dr. Rakel.
I started playing when I was an intern. One of the residents taught me to play, and I played in the Coast Guard. And we had some good games in the Coast Guard. Light's better here. Well, the memory is that the W.B. Saunders Company, you can barely see their name on here, they were the major publisher, medical publisher in the country, that I had written and suggested a textbook of family practice. It worked out pretty well. This was 1973, I think. One thing we did, which was, I think, a good idea, we had each chapter written by a family physician and a specialist in that field. So the content was going to be good and up to date, and it was going to have the perspective of the family physician. And that has held through every edition.
My father, probably my most influential mentor, right? Just seeing his advocacy, his bravery to maybe buck the establishment a little bit and really discuss the importance of primary care and the value that it brings. Before there was even the term value-based care, he was seeing that in order to really improve health outcomes, we needed family physicians working interprofessionally with other professions out in communities, recognizing and listening to what the community needs, and then using our expertise in service of that community's best outcome. And so often in healthcare, we project our science. You need what we know. But family medicine is all about listening first. We were given 2 ears and 1 mouth to be used in that proportion, right? And we need to first listen to our patients, listen to our communities, and then apply our science in service of them. And my father taught me that. I learned a lot just by observing people, and I would observe him. And he would have fun with people, he would build their trust, and then they would do good work together that really had the eye on the prize of the health outcomes that wanted to be achieved or needed to be achieved, and he did that beautifully.
How are you, sir?
No, we don't
Good to
shake
see you.
hands.
That's all right.
You don't shake
I'm a
hands.
hugger to see you. I'm a hugger too. You're looking good.
So are you.
Thank you, sir. Thank you.
I'm still looking. That's right. Besides you.
So this is Bill Coleman.
Coleman, I remember.
Yeah, Bill was the
Yeah.
resident chair then. I was
Yeah.
a 4th-year student. You obviously were at Iowa, and this is Arthur Richardson.
Oh, I thought it was Herb Holden.
No. This was
okay.
the dean of Emory Medical School,
Ah,
who was adamant about not having departments of family medicine in medical schools. That's what the whole panel was about. First day I got there, Dr. Carnegie took me in their little library, much smaller than this. And he said, there are 2 things you need to do while you're here, Doug. One is make sure you start reading American Family Physician, the journal, and look at this book on the shelf, The Textbook of Family Practice by Bob Rakel. And as long as you read that and read American Family Physician, you'll be a good family doctor. So that's how I met Bob Rakel the first time. And then the second time I met you in person, and I was scared to death.
oh, come on.
Oh, yeah. I mean, here was one of the founders of family medicine, my Lord. Big, tall guy.
I was just another tall white guy.
But you told me before this panel, you said you're going to do a great job. And I made my spiel and said, yes, medical school should have departments of family medicine, got a nice ovation. And afterwards you said, keep the passion. And I've kept that passion ever since.
No kidding.
Absolutely.
I'll be damned. Very.
So thank you for that.
Thank you for remembering.
Absolutely. It was a great day.
Dr. Rakel has impeccable character. And when you talk to him, he is so articulate and so in the moment and can recall what it took to get these accomplishments in his career, but also providing the vision for where the profession of family medicine and pharmacy need to go in the future.
Think of all the residents that have been trained and are out there taking care of patients each and every day in a very holistic and comprehensive way.
His foresight and leadership in this area, we served as an important role model for young family physicians to emulate.
The beauty about education is you never know where your influence will stop. And I think my father's influence will carry on long after his presence here on this planet. I remember once you told me that if you need a helping hand, look down and see what's attached to your wrist. The reason I bring that up is because you weren't afraid to go against the establishment. And
We did a lot of that.
and I think, you have to be a special somebody to have the confidence and to advocate for what you believe in. And you're right, at that time still is the case now. What gets the most attention are parts, and you saw the whole. And I think not everybody sees that. And you saw it at a time where we really needed it in creating a whole new field of family medicine.
So yeah, I would describe you as visionary. I think you were one of the few that really had that vision of family medicine.
Hey, let's do this more often.
It's a great honor to be invited to present this address to you today. Actually, the greatest tribute a physician can receive is to be recognized by his or her colleagues throughout the world. And this is one of the greatest honors I've ever received, and I appreciate the opportunity. I hope my remarks are worth your time and attention. After 35 years as a family physician, I'm delighted, as I'm sure you are, to be witnessing the renaissance of family medicine throughout the world. How gratifying it is for all of us in the practice of family medicine to see the value that we serve to society being appropriately recognized as an essential part of model, cost-effective health care. Without you, however, this renaissance would not have been possible. Without your commitment to your patients and your profession, without your willingness to learn and adapt, and without your compassion and communication, which are at the core of our relationship with our patients, this recognition would never have come.